Hello everyone. Today I'm revealing crucial facts about exercise intensity that many people over 40 misunderstand. Shocking research has shown that exercising too hard for health can actually shorten your lifespan. Large-scale medical studies have revealed that excessive exercise after age 40 increases mortality rates by a staggering 39%. The dangerous reality of body changes after 40. Let's first examine the critical changes occurring in our bodies after 40. According to long-term tracking research by International Aging Medicine Institutes, maximum oxygen uptake of the heart decreases by approximately 8% annually from age 40. This means exercising at the same intensity as when younger places excessive strain on the cardiovascular system. Even more serious is the change in muscle mass. After age 40, approximately 5% of muscle mass is lost each year, dramatically increasing stress on joints and ligaments during exercise. Continuing the same exercise intensity as in your 20s and 30s in this state can actually trigger harmful inflammatory responses in the body. How excessive exercise destroys the immune system. According to remarkable research published by world-renowned immunology institutions, excessive exercise causes fatal damage to the immune system. After high-intensity exercise, cortisol levels in the body increase by over 300% above normal, significantly impairing immune cell function. Particularly after age 40, recovery capacity drops sharply, causing this immune-suppressed state to persist for 3 to 7 days. During this period, resistance to viruses and bacteria becomes extremely weak, increasing infection risk by over 6 times compared to the general population. Even more shocking is the chronic inflammatory state caused by excessive exercise. CRP levels, an inflammatory marker, rise to over 5 times that of normal individuals, greatly increasing the risk of cardiovascular disease and cancer. How excessive exercise destroys hormonal balance. Research published by prestigious endocrinology societies shows that excessive exercise seriously disrupts hormonal balance after age 40. Particularly, the secretion of testosterone and growth hormone decreases sharply, making muscle breakdown more active than synthesis. For women, hormonal imbalance from excessive exercise is even more severe. When the balance of estrogen and progesterone is disrupted, bone density loss accelerates, and in severe cases, it can even trigger early menopause. Chronic over-secretion of cortisol seriously impairs blood sugar controllability. Insulin resistance increases, with research showing diabetes risk becomes over 40% higher than the general population. Fatal effects of excessive exercise on the cardiovascular system. Results from large-scale studies by international cardiology societies are shocking. Adults over 40 who engage in high-intensity exercise for more than 15 hours per week showed atrial fibrillation rates 300% higher than the general population. Atrial fibrillation is a dangerous arrhythmia that increases stroke risk by over 5 times. Even more surprising is the effect of extreme exercise, like marathons on heart muscle. Post-exercise cardiac enzyme levels rise to similar levels as heart attack patients. And when this condition repeats, heart muscle fibrosis progresses. Coronary artery calcification indices also appear significantly higher in groups doing excessive exercise. This is a direct indicator of heart attack risk, showing 2.5 times higher values than groups maintaining appropriate exercise amounts. Irreversible damage to joints and bones. According to long-term tracking studies by orthopedic societies, excessive exercise after age 40 causes irreparable damage to joint cartilage. Particularly, cartilage wear in knees and hips progresses 3 times faster than normal, causing premature arthritis. The impact on bone density is shocking. While appropriate exercise increases bone density, excessive exercise actually decreases it. This is due to calcium absorption disorders caused by cortisol oversecretion. Damage to ligaments and tendons is also a serious problem. In conditions where recovery capacity has declined after age 40, Repetitive high-intensity exercise triggers chronic inflammation, which can lead to permanent functional decline. Unexpected adverse effects on mental health. Latest research in psychiatry is surprising. While excessive exercise may improve mood short-term, it significantly increases the risk of depression and anxiety disorders long-term. This is related to neurotransmitter imbalances. Exercise addiction is also a particularly concerning issue after age 40. Many feel extreme anxiety when not exercising and continue exercising despite injuries. This is an abnormality in the dopamine system, showing brain changes similar to drug addiction. Sleep quality deterioration is also a serious problem. Sustained sympathetic nervous system hyperactivity from excessive exercise prevents deep sleep. Sleep deprivation creates a vicious cycle that further reduces recovery capacity. Scientifically verified optimal exercise intensity after 40. So what is the exercise intensity most beneficial for health after age 40? Joint research results from major global research institutions, including Harvard Medical School, provide clear answers. The optimal exercise amount is 150 minutes of moderate intensity. Aerobic exercise per week plus strength training twice weekly. Exceeding this significantly reduces mortality reduction effects, and exercise exceeding 300 minutes per week is actually harmful to health. Expressed in heart rate terms, 65% to 75% of maximum heart rate is safest and most effective. For a 40-year-old, maximum heart rate is approximately 180. So maintaining heart rate between 120 to 135 during exercise is ideal. Age-specific customized exercise intensity guidelines. Exercise intensity must be finely adjusted according to early versus late 40s and individual fitness levels. Ages 40 to 44 should maintain 70 to 80% of maximum heart rate, while ages 45 to 49 should maintain 65 to 75%. Those with little exercise experience need even more conservative approaches. The first 3 months should start at 60% of maximum heart rate, gradually increasing. Rapid intensity increases greatly heightened risks of injury and overtraining syndrome. Recovery time must also be adjusted according to age. Recovery that required 24 hours in your 20s may need 48 to 72 hours in your 40s. Ignoring this and doing high-intensity exercise daily is extremely dangerous. Warning signs your body sends about excessive exercise. Our bodies send clear warning signals about excessive exercise. Resting heart rate increasing by 10 or more beats above normal, or feeling extreme fatigue upon waking, are typical overtraining symptoms. Emotional changes are also important indicators. Being more irritable than usual or significant drops in motivation signal excessive exercise stress. Loss of appetite or sleep pattern changes should also be carefully observed. Muscle soreness lasting more than 3 days or catching colds more frequently than usual indicates immune function decline. When these symptoms appear, immediately reduce exercise volume and get adequate rest. Effective recovery strategies and the importance of rest. After age 40, recovery is as important as exercise. Adequate sleep is a key element that promotes growth, hormone secretion, and reduces inflammation. At least 7 to 8 hours of quality sleep is necessary. Nutrition is also crucial for recovery. Consuming appropriate amounts of protein and carbohydrates within 30 minutes post-exercise can promote muscle recovery and glycogen resynthesis. Foods rich in antioxidants also reduce oxidative stress from exercise. Stress management is an indispensable element. Relaxation techniques like meditation or yoga suppress excessive sympathetic nervous system activation and promote recovery. Adding light relaxation exercises 2 to 3 times weekly is recommended. Personalized exercise prescriptions considering individual differences. Applying identical exercise intensity to everyone is dangerous. Individual baseline fitness, medical history, and genetic factors must be comprehensively considered, particularly those with family history of cardiovascular disease or chronic conditions like diabetes and hypertension need extra caution. Women need exercise plans considering menstrual cycles and hormonal changes. Exercise intensity should be reduced before and after menstruation, and special attention to bone density. Maintenance is needed around menopause. Professional characteristics are also important considerations. Manual laborers may benefit more from flexibility and balance exercises, rather than additional high-intensity workouts. Exercise intensity adjustment for seasons and environment. Seasonal changes also affect exercise intensity control. In hot, humid summer environments, energy consumption for temperature regulation is high, requiring exercise intensity reduction by about 20%. Conversely, winter requires adequate warm-up as muscles and joints stiffen easily. Indoor versus outdoor exercise differences must also be considered. Outdoor exercise involves additional environmental stresses like fine dust and UV rays, requiring intensity adjustments accordingly. For healthy living after age 40, appropriate exercise intensity is key. The secret to true health and longevity is not exercising more or harder, but exercising smarter. We continuously provide valuable health information like this. Please support us with subscriptions and likes, and enable notifications, so you won't miss our latest health insights. We'll continue delivering only verified information for your healthy life.